Mental health workers of Reddit. What's the most fucked up thing you have seen? Not a mental health worker but a camp counselor at a camp for underprivileged kids. We had a camper who had blind rage. He would be completely normal then randomly would fucking snap. The very last day of camp, he was just waiting in line for something when someone threw a rock and it hit the kid who had blind rage directly in the eye, causing him to bleed from his eye. I have never heard a worse scream in my entire life. He then starts running towards the kid who hit him in the eye. It fucking took 4 staff to get this 10-year-old to not fucking kill another kid. Edit. We drove him to the hospital instantly. We were deep in the woods. An ambulance would have taken too long. He didn't lose his eye and is fine. When I was a camp counselor at a camp for kids from inner city LA, we had kids that would have a great time all week, then freak the fuck out the day before they left camp. I was told this was normal. These kids sort of subconsciously ruin the experience so they don't miss it when they have to return to their shitty day-to-day life. I bet that second kid won't throw rocks anymore though. I'm on the angry kid side honestly, because I know I would have done the same thing. I too have a rage switch. While working in a jail, I was called down to someone's cell to assess him for homicidal ideations. When I got there, he had carved pieces of his legs out and stated he was a follower of Satan, whom told him he needed to release some spirits from his body. He had a long history of self-harm, including swallowing glass. He had a high threshold for pain. Jail was not a place he should have been at, but unfortunately mental health funding is one of the firsts to go when there are budget cuts. The for-profit prison industry has ensured that will be the case for now. When I lived in Florida, I read that they have an active strategy to provide just enough resources to mental health patients to get them deemed competent to stand trial so they can be imprisoned for crimes rather than receive appropriate medical care. Bro, you got demons in your calves. Get them out. Not my case but my wife's. She had a case where her client was a 42-year-old meth-addicted mother, whose 20-year-old gainfully employed son was paying his mother to fuck him so she could buy meth. I know who this lady is, and a small chill goes down my spine every time I spot her with her dead-eyed look. Wait, she was prostituting herself to her own adult son? Did we know such horrors could exist in humanity? Alright, this one is really fucked up. I didn't know drugs could make someone go so far. This has got to be one of the top 5 worst things I've ever read. I'm not a mental health worker, but I am a doctor, and one of the most fucked up, but admirable, things I've ever seen was a small and terminally ill child unafraid to die because he'd accepted it and because his parents had always jokingly threatened to kill him when he was causing trouble and he'd gotten used to it. I was an after-school enrichment teacher. One of the kids kept talking about how he wanted an axe for his day so he could kill himself. I reported it to my supervisor and never saw him again. Shit, when was this? This is so sad, man. I was working as a social worker in a women's shelter a few years ago. We had a client with unmanaged mental illness as well as unmanaged diabetes. Her toes had started to decay from diabetes, so she cut them all off, save for the big toe, with nail clippers. Compared to everything else in this thread, that actually sounds not only sane, but like a shrewd, sound choice. If this happened in the USA, she probably saved a bundle on medical bills. Having a DIY amputation, let me reiterate. One of the top level comments is about a guy who chopped off his own arm because God told him to. So the toe clipping only sounds sane in comparison. A thing that happened where I worked years ago. During the shift before mine, dude dug out his eye with a knife to get at the government chip that controls his thoughts. Pretty glad I missed out on that. Not me. Social worker relative, 2 girls. Both being raped by the father. Mom knew. And would make the bed in preparation. One of the girls was in a wheelchair. She got pregnant. The other had been sodomized and was so traumatized she bashed her door handle against her wall to make a hole. Then pooped into the wall space because she was too scared to use the bathroom. I went to school with them both and didn't have a clue. It only came to light because the one daughter got pregnant, so father was arrested. I've been in inpatient psych wards multiple times when I was a teenager. I didn't see any of this behavior. People with suicidal ideation, yes. People self-medicating with substance abuse issues, of course. Self-harm, yes. But everyone got along and it honestly was a very therapeutic environment being around people who also suffered from similar issues and could relate. Even just spending an hour in a psychiatric care facility visiting my sister, I witnessed a very violent individual lashing out. The staff had him alone and in his room, but I could hear him screaming and trying to break things from across the hall and through 2 armored doors. In my own time in a psych ward, I didn't see much either. But it happens whether we see it or not. I work in a state-run facility. I see a lot of things, a lot of bad things. One thing I'll never forget is seeing a girl stick her pinky halfway into her eye because she thought there was a tracking device behind her eyeball. One of the clients we had, inpatient mental health unit, was a cannibal. He had a history of kidnapping healthcare staff with plans to eat them. He wasn't very good at it though and was caught on both attempts. While an inpatient with us, he would write poetry about eating human flesh. Other than that, he was a nice chap. Lots of poop smearing. One client was discharged and left us a poop blood decorated bedroom as a parting gift. One of the most messed up restraints I ever saw was a service user who was extremely unwell, fully naked, urinating all over healthcare staff while in restraint, and all of them just slid all over the place while covered in wee-ha. Obligatory, not a health worker, but felt that it's worth sharing a long while ago. I was admitted into a suicide ward without real reason and spent 3 days there before they realized that things were actually okay and I wasn't at risk. I don't remember much about when I was there, but I can still distinctly remember one of the kids who was coming in to take my room as I was leaving. He was 4 years old, and he'd set his house on fire with his baby sister still inside. I don't know anything else about him or the case, but I still think about it every now and again. I just hope he found the help he needed. I'm not a mental health worker, but my cousin's dad was and he worked in the children's psych ward. These were kids I think from 610 and they were all violent. One day he was supervising the common room and one of the really bad kids, he was probably like 8, lashed out of nowhere and he couldn't have sharp objects because he liked to stab people, so he grabbed this other kid's pencil and lunged it at an aid's face and they quickly restrained him, and this is what he said: "Oh my god, I'm sorry, I'm so sorry I couldn't stab you in your fucking eye." My uncle said he will never forget that. For those reading this thread and saying to themselves, "Ha, my friend Karen is in healthcare, I should ask her the worst thing she's ever seen," I encourage you to remember this. When you ask this, you are asking someone to relive the worst day of their careers for your entertainment. Please think twice. I work in EMS and I have to deflect this question all the time. Guy had been moved out of a subsidized apartment. Fridge full of rotten food. The carpet was solid black like used motor oil had been poured on it. He had dug holes in all the walls looking for bugs they had put in the wall. He was also convinced all of his mental health workers were CIA agents, so he stopped talking to us. So I had a buddy who used to be a security guard for a mental institution. There was a guy there who was nicknamed Trinity. He believed he was himself, God, and Satan. He was out smoking on break and heard alarms going off. He sprinted in the room and said the man tore out of restraints. He said the guy couldn't have been more than 200 pounds maximum. He put his hand on his shoulder and said, "Are you okay, buddy?" The man turned around and pinned my friend against a wall with a broom and said, "Are you okay, buddy? My friend is over 400 pounds. He said the man's eyes looked different. He quit shortly after. On the inpatient psych ward, a dude was inconsolable. We got to talking and it turns out he was schizophrenic and the voices in his head convinced him that the government implanted microphone in his chihuahua. He fought the voices for as long as he could but ultimately pulled his dog apart looking for the microphone. The dog was his best friend. I was a medical student at the time and I noped out of psychiatry right then and there. I worked as a tech on the behavioral health unit of a hospital for 3 years. One patient would put tiny objects he found in places like under his eyelids, in his ears, and up his urethra. It made me sad, as he seemed very distressed by this urge he had no power over. Ultimately he had to be referred to a different facility because it kept happening and there was nothing we could do for him. Our unit was more of a safe place to be while social workers set up things, such as future psychiatrist appointments. The usual stay was from 3 to 5 days. Most of our patients were there for suicidal ideation, although we had our fair share of schizophrenia, psychosis, borderline, etc. I'm a medical student, and on my inpatient psychiatry rotation there was a lady with bipolar disorder with psychotic features. She went into a manic episode during her stay, which was already unsettling because she would just start cackling extremely loudly out of nowhere. But then at the height of her mania she tried to hang herself in the shower because Satan told her to. Saw some other fucked up shit during my short 2 weeks on that floor, but that was definitely the worst. Didn't see it myself but was told by co-workers that a client kept a plastic milk jug in his bedroom, filled with his own cum. Creeps me out every time I think about it. Thanks for reminding me, OP. I work with clients with Alzheimer's. Sometimes one of them think we are married engaged. One day she asked me if our wedding was today. Caught me off guard, and I was like, I have a fiance, and she thought I was dumping her and cried for a long while. Not a mental health worker, but my so is, and she has told me some of the mesh up things she has seen. So what had happened was, it was her grandparents' anniversary this day, so she was already in a low mood. She was at work and was sent on a 2-person visit as they had concerns for one of their clients. The landlord met them at the flat and put the door in. My so walked in and found her client dead on the sofa holding a bottle of vodka. She checked for a pulse and he was dead easily 23 days. She was pretty messed up after that for a long time. Any female child who has been sexually abused by mom's boyfriend and the mother blames the little girl. It's disgusting how common this is. The most fucked up thing was my first day shadowing in an inpatient psych ward. The psychiatrist was a super arrogant and condescending person making jokes about patients and calling them all things. What broke my heart was that he didn't talk to an older gentleman who was suffering from Alzheimer's. His exact comment was, "It saves me time because he is not going to fucking remember it anyway, but I'll still bill his insurance." My best friend is a social worker named Bethany. She went to her client's home for her 3 weekly visit. When her client opened the door, written on the client's wrist was "Stab Bethany." Working in medicine, I've seen much worse things, but on a psychological level, that gives me the heebie-jeebies. I spent a week in a mental hospital last month due to psychosis and suicidal thoughts. Recently I was discharged and began a partial hospitalization program. From outside the room I was in I could hear a very young girl screaming at the top of her lungs, "Don't come near me. Don't come near me," to the doctors and nurses trying to calm her down. It scared me to think what she must have been through. Not a mental health worker, but had a short stay in an inpatient facility a couple of years ago after an overdose. After getting out and rebuilding my life, I met a girl who had been there several months before I was. She had been raped by a member of staff. No one had believed her, and the staff member was still working there when I was admitted. It breaks my heart how the system allows vulnerable people to be abused and exploited, and I still get chills thinking that it could have been me.